My name is Hallie Gonzalez, and my topic is the multi-state outbreak of salmonella agona infections linked to rice and wheat puffs cereal. On May 13th in 2008, state and city health departments from 15 different states identified 28 people infected with the same genetic fingerprint of salmonella. Some of the affected states include Colorado, Delaware, Illinois, Maine, Massachusetts, Michigan, and New Jersey. The presence of this bacteria was found in a Minnesota factory known as Malto-Meal, which produces and packages dry cereal. This 2008 outbreak resulted in a total of 35 illnesses, and from those 35 illnesses, 28 cases were confirmed by laboratory research, and a total of 12 people were hospitalized. This problem exists as a result of mass production of food, which allows greater populations to be exposed when contamination occurs. This company has had previous outbreaks back in 1998 that was similar to the one in 2008. More specifically, the serotype of the outbreak in 1998 and 2008 were the same. The CDC issued a recall of various products that they believed to be contaminated. The strength of this case was that they accurately identified the presence of the salmonella bacteria through their routine food testing. However, this is a recurring problem for this company. For instance, in May 1998, at least 209 people from 11 different states became ill after consuming their products. Similarly, in May of 2008, state and city health departments from 15 different states identified 28 sick persons. However, with the identification and acknowledgement of this recurrence, the company can take advantage of the advancement of technology and implement additional hardware to detect the presence of any contaminants at earlier stages of food production. If, however, they don't take advantage of this opportunity, a threat will be imposed upon the consumer's health. Organizations such as the CDC and the FDA work to improve the health and safety of various food products. After issuing a recall, the company conducted its own investigation on what the source was and claimed to have identified the root cause. However, they did not explain or specify what the root source was. Given that this serotype of salmonella is uncommon and it is found in animal reservoirs such as poultry, cattle, pigs, and animal feed, speculation made by experts say there may be an environmental source of salmonella at the Minnesota plant. The core problem is that industries allow the detection of contaminants. However, the standards do not allow the detection at earlier stages. And although this is the second outbreak from this company alone, organizations failed to enforce this company to publicly identify and remove the source. In regard to this specific case, the CDC, as well as the Malto-Meal company itself, issued a recall on unsweetened puffed rice wheat cereals within specific expiration dates. For the theoretical perspective, we can improve standards and guidelines to allow and encourage earlier detection of contaminants before products get in the hands of consumers. One alternative solution may include enforcing that a HCCP guideline to prevent salmonella contamination at various stages of food manufacturing. Another possible solution is utilizing electrochemical immunosensors, which also detect salmonella bacteria as well as other pathogens. One recommendation is to conduct further research on the source and ensure the removal of this root cause at the Minnesota plant. Another recommendation is to implement stricter standards at each level of food manufacturing. A third recommendation is to utilize technological devices to assist the detection of contaminants in food products. In order to achieve these recommendations, the FDA and CDC must revise guidelines for food safety at the manufacturing level. The action plan may consist of altering guidelines and standards, which would take about 1 year. Following that, officials must ensure that food manufacturers abide by these new standards with regular inspections. Reviewing databases and hospital records may help identify either an increase or decrease in foodborne related illnesses. If foodborne related illnesses have increased or remain stagnant, we must reestablish the standards. In my opinion, I believe that the organization that organizations such as the FDA and CDC should work on revising standards to ensure early detection of food contaminants as well as the overall safety of food. I believe that this case is a perfect example of why we should improve the standards of food manufacturing, as the outbreak in 1998 was extremely similar to the more recent outbreak in 2008. This recurrence is evidence of a flaw in the food manufacturing system.